Watching News 4 Midday.
There are some simple steps you can take starting today that will improve health for 2012. And joining us to talk about those steps is Dr. Gary Kaplan from the Kaplan Center for Integrative Medicine. And thank you for coming.
Thank you for having me here.
I think the thing that really caught my eye was when I read in the paper that you said chocolate was a good thing to do.
Dark chocolate. But chocolate's an excellent thing to do.
Oh, let's talk a little bit about that. And we have some samples that Whole Foods was nice enough to send over, sampling from a lot of different manufacturers. And you tell me, though, that you got to be careful about what you pick.
You want the dark chocolate.
Dark. No milk chocolate, and that's my favorite.
Not the milk chocolate, not the white chocolate. It needs to be dark chocolate.
Okay, before we sample some of these, tell us why chocolate is a good thing.
Chocolate, it falls in the category of a superfood. Superfoods are foods that have a lot of health benefits for us. So chocolate actually can lower blood pressure. It can lower it as much as dark chocolate we're talking about. It can lower it as much as doing moderate exercise on a regular basis by about 5 millimeters of mercury on the high end of the systolic blood pressure and about 2 on the diastolic. But that translates into a 20% decreased risk of cardiovascular disease over 5 years. So that's a big deal. So a little bit of chocolate goes a long way. It increases the elasticity of the blood vessels. It decreases plaque formation in the blood vessels. It lowers the LDL cholesterol, the bad cholesterol that we're always concerned about.
Well, who knew? I mean, we've been avoiding eating this sweet stuff for a long time to keep from gaining the pounds.
But we want to make sure we're getting the right stuff. Okay. Because it's the dark chocolate that really has the advantages. And if you have the Dutch chocolate, which you get in cocoa and stuff, the problem with the Dutch chocolate, it's been alkalized and it destroys a lot of the flavonoids, which are responsible for the benefits of the dark chocolate. So you run it and get the stuff that's about 70% is kind of ideal in percentage. But then the fun begins because there's lots of different ways that it gets manufactured. Some put in spices, some put in nuts and walnuts and whatnot. And you can add those as well. You don't want to be eating the stuff, though, that has marshmallow in it and caramel.
Okay, all right. So you got to read the labels.
Calories.
And as you were just pointing out to me with these wonderful chocolates that we have here, they do come in different percentages of chocolate, and you should look for those that are at least over what percentage?
You really want it, certainly over 50%, preferably close to 70%.
And will we see a difference in the taste of the ones that are like, here's one that's 70%. Is it a lot stronger tasting? Maybe let's try it.
The higher the percentage of cocoa, they tend to be a little bit more bitter. Okay?
All right, a little more bitter.
So, it's an acquired taste.
You want me to taste? Here.
You have some taste. We'll both have a little taste.
Well, actually, this is really very good. Now, that's 70%. But if 50% chocolate tastes better than 70%?
Well, to get the health benefit, this is very good. To get the health benefits, you really want the higher percentage of cocoa. Because it's cocoa beans, which aren't actually beans, they're seeds of the cocoa tree fruit.
This is 70% too. Pure Icelandic chocolate. Did you have thought that chocolate comes from Iceland?
I didn't realize Iceland actually grew cocoa trees, but
well, I'm liking this, but we need to move on quickly to talk about a few other things. You say you should also add fruits and vegetables to your diet.
You need fiber. And by the way, the antioxidant levels from chocolate are actually, the cocoa, is actually higher than it is in fruits and vegetables, but you don't get the fiber.
Okay,
and you don't get a lot of the other vegetables. Sleep. You need to be getting 7 to 8 hours of sleep a night. Sleep is neuroregenerative. If you reduce sleep to about 5 hours a night, 6 hours a night, after the end of 1 week, you are driving the equivalent of being drunk.
Now, some people would say don't eat the chocolate before trying to sleep because that's going to
also because you get a little bit of caffeine from the chocolate and a little bit of stimulant from the chocolate, and so that actually may interfere with sleep. So you want to keep the chocolate away from bedtime.
Do try to program time for sleep.
You have to schedule it. It has to be in part of your required daily routine.
And as you say, exercise must be as well. Is that
exercise,
right?
You want to be walking. The goal is 10,000 steps a day, which is roughly 5 miles. It doesn't have to be done all at once, but you can do it in spurts throughout the day. But you can also be working out, doing a good aerobic exercise. Measuring aerobic is defined as your heart rate between 220 minus your age is 60, 80% of that number, and staying in that range for a good 20, 30 minutes with a 5-minute warm-up and a 5-minute cool-down. So all of those things are neuroregenerative. They reduce inflammation in the body. They reduce blood pressure. And chocolate in particular also helps reduce the coagulation of platelets, which we take an aspirin a day for. You can get the same kind of a benefit eating a little bit of chocolate a day. How much chocolate? About 1.5 grams to 3 grams, 3.5 grams a day.
And
no
that'll
more.
help with the reducing of the inflammation, which you
Right.
say is really important.
Absolutely.
All right, fantastic. Well, anybody who didn't get all of that or wants to remember it, you'll be on our website, NBCWashington.com. Thank you, Dr. Kaplan,
Thank you for having
coming
me.
in. We really appreciate hearing how we're going to be healthy for 2012.
Eating chocolate.
Yeah, okay, thanks so